My name's Les Anderson and I'm chair of South Ayrshire Seniors Forum. Over this last year we've been doing a lot of work with older people, alongside older people, and we don't do things to older people.
Sure.
And that's part of the issue for older people in terms of, specifically in terms of the integration agenda. And what we're very concerned about is that wellness you were talking about in terms of feeling safe, feeling that you understand where you are and how you can manage your life is not there as much as it should be with older people. And that's because historically older people, as you were saying, have had things done to them as well, not with them. And my concern, or our concern, this last year we talked to a lot of older people by running information roadshows. I'll try and be as brief as I can. And the concerns in terms of their future health, their future care, are very serious because, for example, the last Care Inspectorate report in terms of care homes, 49% of the complaints they received were about care homes. They're worried in terms of the fact that GPs have not been involved in the integration agenda. And as you know, for many older people, their doctor is their first point of contact. And if the doctor's not involved, how are they going to find out what changes might be coming? So it's those kind of issues that
Sure.
we are concerned about with older people. And that's what they're saying, not what I'm saying.
I never go places and tell people what to do. Okay, well that's not strictly true because my own local communities started doing some of this and boy, do I tell them what I think they should do because I've got ownership of that, I'm part of it and so on. What I would say to you is that as we move, there's a lot of energy and effort going into the Early Years Collaborative just now. As we get into the older people's agenda, all of these issues need to be on the table, but the solutions to them have to be found by the front line. Just one comment about the GPs. I've got GPs aplenty who are saying to me, actually, the way we work isn't very clever. We've got a contract here negotiated by the BMA that pays us for measuring blood pressure and all that kind of stuff. But actually what we need to do is work differently with social care, with the third sector, do things differently. Can we find different ways of paying us so that we've got time to do that? So you're pushing against an empty door in lots of different respects. So the thing is that as we move into the older people's agenda, people like yourself involved in older people's issues across the whole of Scotland need to fill that room in the SECC the way that the Early Years Collaborative have done. And we will take you through the method that allows you to populate it with ideas and test it. So it's about method and it's not about me saying, the only thing I would say is this business of the solutions are there to be co-produced by people themselves and people working with them. And that has to be the sort of guiding light in all of this. So collect all the data and bring it out when the time comes, and that will be sometime next year.
My name's Kenny Leinster. I'm Head of Community Care and Housing in South Ayrshire Council. The approach that we're taking here is an approach which starts off with a fundamental basis to it, and the fundamental basis is the vast majority of the people who provide the vast majority of care in our society is not the social work service, it's not the council, it's not the NHS, it's other people. It's friends, neighbours, partners, sons, daughters, mothers, fathers. They do the vast majority of the caring. And our responsibility as a local authority, and to some extent the responsibility of health services, is to get alongside these people and say, how do you want us to deliver the care which meets your needs, but allows you to continue delivering that care and allows you to remain living at home. That's the approach we're taking here, and it's a slightly different approach. We don't think as a local authority we know better than anyone else. We think that we've got a huge amount to learn. Yeah. And that's not only in relation to older people, but it's in relation to all the work within our communities. And what we need to do is we need to get alongside communities and sit down and say, how can we help you to manage your community? That's what our job is. These are different communities. You might get a geographical community. You might get a community that's determined by the fact that they're homeless. You might get a community determined by the fact that they're older. You might get a community that's determined by fact that they've got an alcohol or a drug problem. And our responsibility is to help them manage that, not to do it for them.
We're all moving into new ways of working here. We're all feeling our way in all of this. And I think remaining open like that to these possibilities is really important. I should say that the week before last, I was in Montenegro. Those of you who knows where Montenegro is, it's just a wee bit south of Albania, okay? As I was at the Southeast Europe Health Network at the request of the World Health Organization. And the Southeast Europe Health Network, the chairman of that's from Bosnia, and he really wants to work with Scotland on healthy ageing. And folk are starting to say, hey, wait a minute, you've got a way of doing things here, you've got an attitude and approach that we're beginning to sense will make a difference. And it's this method, but it's the way we do it. But critically in all of this is daring. Don't wait to be told to do things. If you've got a good idea, just do it. And if it works, tell folk that it works and start spreading the word. Be daring and don't forget the hugs. That's the critical thing, okay? Do what you think is right and then tell folk about it.
Hi, I'm Colette McGarva. I work in community development and engagement. My question relates to the issue of hopelessness. And I'd like to ask you what your thoughts are on the attitudes and judgmentalness towards people who live in disadvantaged neighbourhoods. What can be done about that other than promoting all the good work that's done in disadvantaged neighbourhoods?
I don't have an answer. I don't have a solution to that other than to say we have to start talking in terms of Father Boyle's comment. Actually, how do you think you'd get on if you were in these situations? The kind of things that we hear politicians standing up and saying some people are too thick to work and all. Come on. It's hopeless. That is hopeless. So we have to keep talking about it. And you won't find too many chief medical officers who actually talk about love as a health promoting factor, compassion. But that's what all the evidence says. That you do that kind of thing, you care, you show care for others, it gets reciprocated and it causes change. And the other thing that I studiously avoid doing is talking about the economic benefits of this. When you get things right, then you get more young people being economically productive and fewer older people being dependent, and there's a big economic payback. But that's not why we should do it. We should do it because it's the right thing to do. So we need, as a society, to stand up and say, the right thing to do is to care for people in difficulty. And the more we say that, the less stigmatizing it will be. And I don't know any other way to do that. We can't pass a law. Someone might try to pass a law, but it will be a terribly bad law. Okay? So I've got no answer, but just keep saying it. Keep saying it and keep doing it. Keep talking about the importance of it.
I suppose it's we're in a really interesting time because we're in the middle of the integration process, and I suppose there's civil servants probably as we speak beavering away producing lots of documents about it. And it seems to me this is our chance to do something quite different. And I wanted to kind of your thoughts about what might happen at the centre to sort of enable that to happen. I suppose every time I see the things that come out, it goes to the usual default position. So it's kind of like what you described there with the civil servants at Journey kind of stuff. And it seems to me that if we're radically trying to do something different, there needs to be a kind of real momentum at the centre to say, let's actually do something different here, because this is a real Kairos time.
And there are real efforts taking place. The Permanent Secretary is absolutely committed to this kind of thing. He sends out memos in which he talks about making a particular thing comprehensible, manageable and meaningful. He's heard the talk and he's absorbed it. And he's got people across the organisation working to understand the idea of assets and co-production and how do we embed that in the way we work and all that kind of stuff. And ministers are bought into it as well. John Swinney particularly, trying very hard to find money, change funds and all that kind of thing. So there is a willingness to do it. The problem is when you've run your life for many years by a particular set of beliefs and someone comes along with another set of ideas, you may say, well, that's very persuasive. What you tend to do is you tend to adopt a language, but you carry on doing it the way you've always done. So that's what we're trying to overcome just now, and they're conscious of that. And there's a lot of self-examination going on as to how, not just in Scottish Government, but with colleagues in COSLA and so on, as to how actually, what does this really mean if it looks different? And we're in a far better place than most. I mean, I was in Copenhagen a couple of weeks ago in the Department of Health, and in the Danish government, all the ministries are in different buildings scattered around Copenhagen. I walk along to, if I need to talk to colleagues in justice, I walk 50 yards and I'm talking to them. And we do that regularly. So there's much stronger integration than there is in other countries where they believe the success lies in their own particular silo. The Danes were really struggling to get their head around the fact that, but what can we as GPs do about this? I said, well, you can stop being GPs and start being people for a start. Don't define yourself by your profession, define yourself by your humanity. And, okay. And it's a slow process. But we keep talking about it, and there, I can reassure you, Phil, that there is a very strong willingness to get this right. I mean, John Swinney's comment after he stayed at the Early Years Collaborative for that length of time was, this is public sector reform in action. This beats anything I have ever seen before. And I think other ministers are seeing that.
I'm Valerie Stewart, the Community Planning Coordinator in South Ayrshire. I'm aware you sit in the national group, Harry. I'm also part of the Early Years Collaborative. I don't know if you can answer this, but if you can give us a few pointers. How do we as officers and elected members and people who are part of all these new and different ways of trying to do things come back and persuade our leaders and our politicians when we're in the stages of very, very severe budget cuts across the whole public sector, persuade people to look at moving resource to prevention and early intervention, which will later take demand out the system for public services and actually be a saving in the long term?
Use your own powerful means of persuasion. Obviously, it's at an individual level, it's about ways that you know how to work. But actually, at the end of the day, they will be persuaded by the fact that they're down here and other councils are up there. What will happen is other places will be more daring, and they will do things and things will change and the curves will go in that direction in other places, and then folk will start to ask the question, why are things not happening here? Now, we talk about this data we collect as being data for improvement, not for judgment, and that's absolutely the case. We will fight tooth and nail to make sure there aren't any league tables around us. But at the Early Years Collaborative, folk go and they'll see those things changing. And they'll say, why can't we do that? What did you do to make that happen? All right, okay. And that's the whole point, and it'll take 5 years. The patient safety programme, 5 years on, we calculate there have been 9,700 fewer than expected deaths in Scottish hospitals as a result of the patient safety programme. You know, the line was going like that, and it's gone like that, and the gap between the two. And some places haven't done that as effectively as others, and inevitably that's going to cause them some difficulty. But, you know, that's the way it is. The early adopters will be up and running, and they'll be the pathfinders for the rest, and the rest will have to follow. And they need to realise that they need to get on the front foot in some of these things.
Yeah, thank you. We're all kind of struggling with prevention plans and trying to get people to think, 10 years from now where we would like to be, but we have to start now to look at how we shift resource and do things differently, really picking up from what Phil was saying.
Yes. There are about probably 10 things that the patient safety programme has introduced that now are embedded. That it's the way we do things around there. We've changed the way hospitals think and work, and this is what they do now. And that will happen across other sectors. And if people want to be in the vanguard, better get on board the train.
Hi, I'm Rita Miller. I'm an elected member for quite a disadvantaged part of Ayr. I was very interested in that, and I was listening to some work that's been done in Chicago talking about how Afro-American people can actually go down in comparison if they live in a disadvantaged area that's multi-disadvantaged, or if they live in a slightly better area, they can go up.
Yeah.
And the difference is the community support and the fact that it's a helpless area. So I think that fits very well with what you're putting forward. I think one of the problems is that the Scottish Government still hasn't got it joined up. I actually don't think there's such a thing as a prevention plan, early intervention. I think it's an approach. And I think they actually send people scuttling into trying to put out papers and tables and all sorts of things. It's actually a change in the culture. It's a change in approach. And that's what the message that John Swinney and his people should be putting forward, I think.
Yeah, but you still need a method. You still need a method for change. Chris Hoy says that the reason British cycling was so successful was the accumulation of small gains across lots of different things. That's what collaboratives are there to do. Look at the 5 principal drivers, the 20 secondary drivers, and under the 20 secondary drivers, the 5 things that you can do to change those. So there's maybe 100 different things that people are trying to do. And they'll be doing, some won't be doing any of them in one area, but lots in another, and so on. It's just about what local sensitivities and local needs are that drive it. But gradually over the years, they will all come together, and they'll all be doing things, and they'll all be moving in the same direction. And that's it. I've been involved in strategic planning for the best part of 25 years, and I never wrote a strategic plan that changed anything, to be fair. Well, that's not strictly true. The new Southern General was probably the part of one of them. And those of you that drive up there see that this building that's blotting out the sun. But strategic planning, it's that thing. Folk at the front line deliver change, and they have to be part of deciding what that change is. And in becoming part of it, that's when the culture changes. You have to start doing things. Talk is just talk until people do things as a result. So do something brave. Do something dangerous. And if it works, tell folk. If it doesn't work, just keep quiet about it. But, this business about what determines. If you think back, everyone in this room, if we go back far enough, had ancestors who were poor. We've all emerged from poverty. Poverty doesn't cause failure. It's poverty in association with other things. My grandfather was dirt poor. I'll tell you a story. My father left school when he was 15. And he went to work because the family were poor. And he went to work washing bottles in a lemonade factory. And he was there for about 4 or 5 days, and his school teacher appeared alongside him and said, "Come on, son, you're coming back to school." School teacher would probably go to jail for doing that now. But my father went back to school and ended up with degrees in physics, mechanical engineering, chemical engineering. He got involved in building secret weapons during the war. He got involved in building the hydrogen bomb after the war. I've got a picture of him with a Russian spy, actually. A guy who worked there who defected, a guy called Pontecorvo, got the Order of Lenin or something like that, My dad lived a really interesting life, all because that teacher did something brave. Saw something in my dad and said, "Back to school." Where would I be if that teacher hadn't done something brave? Where would my children be? Tell you, they wouldn't be costing me the amount of money they're costing me.